Time. So, welcome everyone. Once more, we have a great Glaucom ISN seminar. And for today, we have an excellent speaker. Up to now, the floor is yours.
Thank you very much, Carmen, and welcome everybody. Today, we're going to have an excellent speaker, Dr. Olga Vorobyeva. She's a renal pathologist from the National Center of Clinical Morphological Diagnostics at St. Petersburg, Russia, and she is a member of the ISN Renal Pathology Working Group. Olga is going to talk to us, giving examples about apolipoprotein E gene polymorphism and chronic kidney disease. We would like to leave the questions at the end, so please feel free to write any questions you have on the chat, or we can have a live discussion when Olga is done. Olga, please.
Thank you. Thank you, Carmen. Thank you, Wesam. I'll try to share my screen. Is it okay?
Yes.
Yes,
okay.
it's okay. Yeah.
Okay. Thank you. Well, good morning or afternoon or evening, any part of the day, dear colleague. That's my honor and pleasure to share some little experience and about the association between apolipoprotein E gene polymorphisms and kidney function. And namely, today we are talking about 3-4 variants of its polymorphisms based on 2 cases that's as bright examples of the topic, and followed by mini review. The very important, general but very important information is as follows: that apolipoprotein A gene located on chromosome 19 and codes for apolipoprotein A. That is a glycoprotein by its nature and belongs to a family of fat-binding proteins. It is a part of several classes of lipoproteins, chylomicrons, very low density, intermediate, and some high density lipoproteins. In peripheral tissue, apolipoprotein E is mostly produced by hepatocytes and macrophages, and in the brain, it's mainly produced by astrocytes and transport cholesterol to neurons. This glycoprotein interacts with the low-density lipoprotein receptor on a hepatocyte surface, and it's essential for the triglyceride-rich lipoprotein catabolism. So apolipoprotein E plays a central role in lipoprotein metabolism and lipid homeostasis because it regulates total cholesterol and triglyceride metabolism. It mediates very low and low density lipoprotein catabolism. It mediates de novo high density lipoprotein genesis and associated with the lipoprotein A level. The elimination of low density and very low density lipoprotein proceeds in the liver. And actually, any kind of apolipoprotein E gene abnormalities finally lead to impairment in binding of lipoproteins to a hepatocyte receptor. And as a result, it leads to delayed or blocked the excretion and accumulation of lipoproteins in a tissue. And so apolipoprotein A function, also we know that it's well-known clue factor in Alzheimer's disease and cardiovascular diseases. So renal tissue damage in patient with the apolipoprotein E gene abnormalities, it's a rather rare condition. and it's not uniform nosology.